Still talking health, the Nasarawa State Primary Healthcare Development Agency has organized a one-day engagement for health partners of the Immunization Plus and Malaria Progress by accelerating coverage and transforming services projects. The project, which is jointly funded by the federal, state governments and World Bank, seeks to reduce child and maternal mortality and make healthcare service easily accessible. Senior reporter Godwin Agwam has details.
Leaders of the health sector in Nasarawa State gathered in Akwanga local government for a one-day engagement on the Immunization Plus and Malaria Progress by accelerating coverage and transforming services impact projects. The impact project is being executed in 20 states across the country, and this is targeted at improving the utilization and quality of Immunization Plus and malaria services. The aim is to reduce maternal and child mortality through the strengthening of health system.
So by end of 2027,
this one-day engagement with partners in the health sector is to assess the performance of the project in the previous years and brainstorm on the best way to achieve a better result in the year 2025.
We are here so that you can at least know what is impact is and how can you play your role so that the result we are expecting to achieve before impact finish, that is the end of by December 2025, will reach that stand.
And Nasarawa State now will, for every 5 kilometers, at least you assess one PHC or head post. But up to now, some of our citizens don't access health service, and that's why we brought in these stakeholders so as to sensitize them on the need to make sure that our citizens patronize health services.
The National State Governor restates his commitment to reduce child and maternal mortality and is willing to improve government policies to fight malaria.
We need to actually review our strategies on the distribution of insecticide-treated nets to all corners in Nasarawa State. And of course, we know that's a preventive strategy that will prevent a lot of persons coming down with malaria.
The health partners are ready to match their words with actions to ensure that much is achieved in the year 2025.
Promise that all the development area and the local government, we used to have our convention and meeting. We'll make sure we tell them.
It is expected that at the end of this stakeholders' engagement, more health workers will join in the campaign to improve immunization and combat malaria at the various health facilities. Godwin Agwam, TVC News, Akwanga.